The vaccine is supposed to be free, but the legislature is setting aside money to ensure that's the case.
All in favor of approving the motion, say aye.
Aye. Aye. Aye.
At its most recent meeting, the legislature's powerful Executive Appropriations Committee set aside $60 million for COVID-19 related emergency funding.
That $60 million is something we just set aside. Those are state funds. We set those aside to use them in case.
Some of that is to cover the cost of vaccinating essential workers, the elderly, and the general public when it's available.
We'll make sure this gets paid for. But our understanding right now is that the federal government is going to take care of this, but we've set aside money just in case.
Senator Jerry Stevenson oversees the budget for the state Senate. He says there's a reason they want to make sure it's essentially free for everyone. It's to remove barriers to getting it. If you don't have to pay out of pocket, it's one more reason to get the vaccine. The more people who get the vaccine, the more things can open up and return to a sense of normal.
We need to really get to 70–80% to make sure that we're not going to have to go back and go through this again.
Utah's Department of Health is still rolling out the vaccine. Healthcare workers across Utah are starting to get the first doses. The latest timelines call for long-term care facilities and assisted living centers, schools, and first responders to get it by the end of January, essential workers by February or March. Then most people over 65, people with jobs in childcare, personal care, then specific community groups, and finally, all Utahns. In an interview with Fox 13 earlier this week, Governor Gary Herbert predicted it could be April when all Utahns are offered the vaccine.
I think we'll be probably by April that we'll have enough vaccines that anybody who wants to have the inoculation can get it. That'll make 2021 our really great year of recovery. And I think by summertime, we'll be in full-blown recovery and go back to more normalcy when it comes to our social interaction.
It's important to note that vaccine timelines speed up and slow down based on dosage availability from drug manufacturers. The state health department hasn't yet decided who's an essential worker and gets moved up on the priority list. We understand there's quite a bit of lobbying going on to get people categorized as essential workers, but the governor's office says it's prioritized based on risk and not privilege. On the Hill, Ben Winslow, Fox 13 News.